Friends, I am Dr. Surjit Ghosh. Welcome to my channel, Dr. Ghosh Presents. Tissue salt therapy, part 10, Calcarea Fluor 4. Calcarea Fluor 4. If you are new to T.S.T, tissue salt therapy, viewing parts 1 to 6 is a must. This is for those who want to learn this seriously. If you are a casual reader, you can read it without these parts. But if you are a serious reader, then you must view part 1 to 6 first, so that you can follow other things. Starting with 3 dots, that means 2 dot or 3 dot is means starting with means it is continuation. Hodgkin diseases. Two types of Hodgkin disease is actually cancer. Mind it is cancer of lymphoma. Hodgkin lymphoma, non-Hodgkin lymphoma. Both are cancer of lymphocyte cells. Lymphocytes are part of our immune system. Depending on the number of cells affected and their location, they are grouped as non-HL lymphoma, non-Hodgkin lymphoma, and Hodgkin lymphoma. Between the two, non-Hodgkin lymphoma is worse. If this swell up to a very solid hard mass or into soft lax mass, then Calcarea for 12x or 30x are employed to tackle that initially. Now you may wonder that tissue salt can be applied. I mean, these are capable of controlling cancer. Yes, this has got that power to cancel or to tackle if it is used initially before the parts ruptures or makes a serious looking ulcer. Before that, that is a soft mass or a solid mass, just a few months, then Calcarea Fluor is sufficient. Is sufficient to tackle this type of disease. Now, this is a picture of Hodgkin lymphoma. Now, how you know that is in Hodgkin lymphoma? Actually, what doctors do? Doctor is to examination cutting a lymph gland here. It is called cutting biopsy. From cutting a particular lymph gland, they will examine the tissue under microscope and Stern Rydberg cells, special cells that are available in Hodgkin lymphoma. This is the confirmation. You may not do this because this cutting biopsy is exclusively surgeon's work, but you can ask him to get it confirmed or whether what type of disease is this, so that your patient may go to a particular pathologist and he will do this on behalf of you. But if it are the doctor used to be a surgeon, then he himself can do it. But you cannot do it. Please mind this. Another thing I will remember this. I will just give you an important thing. Two medicines, mind it. First medicine, Calcarea Fluor, and last medicine, Silesia. These two medicines are exceptional medicines. They can do a lot of miracle in very, very complex type of diseases. Mind this. No other medicines, no other of the 10 are comparable to this first and last. Please remember this, and you read this Calcarea Fluor and Silesia as many times as possible. As many times, maybe you may read this 100 times, 200 times, doesn't matter, because these require tremendous attention, devotion, and studying the symptoms seriously. Chronic skin diseases. During winter, skin looks cracked, ruptured, especially the edge of the feet, palm, nipples of breast, etc. Fissures in anal region, toxic fistula, whose opening is swollen, indurated, and wherefrom thick yellowish pus comes out. Dry skin diseases look like dry scales of fish. It is called ichthyosis, like the skin of a fish, with piles, eczema, and or erysipelas of anal region. This so many images have been given, and these are just relates to this discussion. You please go through it and please relate it. Names are given below. Please just relate it. 24. Palpitation owing to hypertrophied heart. Picture 1. Edema due to heart disease. Picture 2. Calamure is also required here. Emphysema. 3. With Ferampos, that is Ferampos and this particular medicine Silicea are to be applied. 25. Initial stage of all cancer. Mind it, initial stage of all cancers if swollen mass is very hard. If swollen mass is very hard, then initial stage of all cancer, this is the gum cancer actually, and it is swollen and a hard swollen mass. So you can treat it with Calcarea Fluor. Mind it, already have said that Calcarea Fluor is an exceptional. That is first and last. Calcarea Fluor and Silicea. These two are exceptional salt. They can do magic against very serious diseases. Very serious diseases that you cannot think of. If you study it seriously, you can gradually understand. This is picture 1, that is heart is hypertrophied. This is edema or accumulation of fluid in the tissue space. This is emphysema. Emphysema means actually the heart is elongated and full of air. The air is blocked there. That is, the patient cannot empty his lung. Emphysema means the lung is already inflated. The patient cannot easily breathe out the air within. Actually, this is due to loss of the elasticity of the lung globules. You know, in lung has got fine air lobules at the end. That air lobules, when air lobules got this loss of elasticity, then emphysema occurs. And this, if you get a skin X-ray, we see this type of X-ray, totally black. Mind, look, note this, totally black. Sleep dream. Vivid dream with sense of impending danger. Dream of new places, new scenes. Having dream tend to flee away with fear. 27. Fever. Adapted to old fever, not new ones. Mind it, not new ones. Old fevers. For old fever, there are very few medicines. This is one of them. Calcarea Fluor. Generally, spleen. Number 1, or liver swollen, indurated with fever, ascites, accumulation of water in the abdominal tissue space, with vein on the skin of the abdomen distinctively visible. Note these things. This is ascites. The veins are visible on the abdominal skin. Tongue. This special type of tongue, this cracked tongue. Lip, very dry and cracked with thirst. Potency, 12x onwards are generally used in these cases. Amelioration, aggravation, better from heat, continuous movement, palm moving over lightly, worse from damp places, moist air, cold and rest. This is enlarged spleen, this is enlarged liver, or the actually indurated liver, not only enlarged. This liver is already out of normal consistency. This liver's consistency is very soft and smooth. That consistency lost here. It is indurated, means it has become tough. Maybe it is in the second or third stage of liver hepatitis. Life case: Mrs. Gina Modak, aged 42, had been suffering from pain, rheumatism for last 5 years. Reported biting pain on both sides from knee to feet with occasional current-like pain. Troubles get worse in cold and from movement, better in warm, fermentation and locomotion. A lot of treatment were received with transient relief. From old prescription, I noted that many deep-acting homeopathic remedies up to 1 m potency were applied. I determined to apply tissue salts. Straight Calcarea Fluor 30x 1 dose in morning, empty stomach after 3 days was prescribed for 1 month. That is every 3 days, one dose 30x for 1 month. Mrs. Modak informed after 3 weeks that her troubles were better by 50%. It took about 6 months to finish the case with 200x potential. Another life case, very short life case. Shri Bose, aged 48 years, had been suffering from chronic troubles of ear, pain, heaviness, hard of hearing, sometimes slight fever. Took a lot of modern antibiotic treatment which used to give temporary relief. Examination with otoscope revealed that there in the eardrum a lot of white lime-like substances are there. He was fully recovered with the treatment of Calcarea Fluor, 30x and 200x for about 6 months. Note this. This is the actually this is otoscope. With this instrument, with the help of the instrument, we can look into the inner parts of the ear. Inner means actually drum, eardrum, the tympanic membrane, etc. Because thereafter, if there is tympanic membrane, beyond that you cannot see. You cannot see it with the help of this thing because that is an opaque screen. And these are the fine instruments with the help of ears is cleaned. Fine instruments. With this, the video ends. Many thanks for listening and viewing. If anything troubles you, please write down in the comment section. I will certainly respond.